on YouTube. Okay.
All right, everybody, if you are not speaking, please make sure you're muted. Good morning, everybody. We are here for the Appropriations, Human Services, and Public Health Committee's public hearing regarding block grants. And let me see, Representative Walker is going to be signing on, and her computer is acting up. Representative France, are you on? Senator Minor. I'm sure they'll both be on soon. In Public Health, Representative Steinberg, are you on?
I'm here. Thank you, Madam Chair.
Do you have any opening comments to make, sir?
Only that we have a lot of ground to cover and a lot of detail. We're helping a lot of people today, and we should get started. Thank you, Madam Chair.
Great. Senator Anwar?
Yeah, I'm here as well. I'll just echo my co-chair, Jonathan
Yes,
Steinberg's
I do.
remarks.
So I have to.
And Representative Pettit? Senator Wong or Senator Summers? Opening comments.
Good morning, young lady. You look spectacular. Let's go.
Very good. Human Services, Senator Moore. Representative Abercrombie.
Good morning, everyone. Look forward to getting this meeting started.
Senator Berthol. Representative Case.
Good morning. Let's get rolling.
All right. Commissioner Gittani, you have the whole of DPH is here today, I see. You can go ahead and start with your comments, ma'am.
Thank you very much. This is actually just a fraction of people working on public health, but a large group of people certainly working on the issues that we're here to talk about today. So first of all, I just want to thank you for this opportunity, and thank you, Senator Austin, Representative Walker, Senator Minor, Representative France, Senator Anwar, Representative Steinberg, Senator Huang, Summers, and Representative Pettit. And then from Human Services, Senator Moore, Representative Abercrombie, Senator Berthel, and Representative Case. So I'd like to first start with talking about the Preventative Health and Health Services Block Grant. This particular block grant provides funding to address each state's unique public health needs in innovative and locally defined ways. So this particular block grant, the funds from this really support work in the areas of asthma, cancer, cardiovascular disease, childhood lead poisoning, diabetes, smoking cessation, injury prevention, suicide prevention, rape crisis programs, Connecticut public health surveillance and evaluation efforts, and other national and local public health accreditation initiatives. The funding for this is roughly at a flat level based on fiscal year 2022, and the estimated 2023 allocation will include a base award of roughly $2.165 million, in addition to a mandated sex offense set aside of roughly $75,000, which is intended to provide rape crisis services to rape victims. The department particularly looks forward to implementing the tiered grant system, which was developed in conjunction with local health departments over many months. And this shift to a tiered grant system is intended to provide amounts of annual funding that will be more impactful within communities. I'll stop there on this particular block grant and ready to take questions. Senator Austin, you're on mute if you were asking.
I know, I'm sorry. You can go through all the grants, Commissioner, and then we'll ask questions of you.
Thank you. So the second block grant that I have to present is on the Maternal and Child Health Services block grant. This particular block grant promotes the development of service systems to meet critical challenges, including reducing infant mortality, access to comprehensive care for women, promoting the health of children by providing preventative and primary care services, increasing the number of children who receive health assessments and treatment services, providing family-centered, community-based, and coordinated services for children and youth with special needs. And per federal requirements, at least 30% of funds must be used for prevention and primary care services for children, and another 30% must be used for children and youth with special health needs. So the services that this particular block grant provides include management services for pregnant women, maternal and child health information and referral services, for example, the 211 hotline, reproductive health services, oral health, school-based primary and behavioral health, infant health and well-being, newborn screening, medical homes for children and youth with special healthcare needs. The plan that is proposed for fiscal year 23 is a budget of roughly 4.6 million, which is level funding as compared to fiscal year 22. And proposed expenditures include areas of reproductive health services, information and referral, genetics and school-based health services, and then supporting the implementation of AIM, or the Alliance for Innovation on Maternal Health, the patient safety bundles, which was particularly worked on in collaboration with the Connecticut Hospital Association and with birthing hospitals as collaborators. Funding for the medical home community-based care coordination services program will be increased because of additional duties for the Educating Practices Provider Training Program. And particularly the perinatal case management program will be decreased in fiscal year 23 while a request for proposals is released. There will be no decrease in services because what we're trying to do is leverage funds from other federal grants and savings realized from personnel retirements to support this work. And our goal with this RFP is to provide prenatal and postnatal care via mobile services and prenatal education via telehealth to fill gaps that are being seen in our community, particularly with a shortage of OBGYNs and where hospitals have suspended labor and delivery services. So that is the conclusion of my presentation on our Black grants. Happy to take any questions.
Thank you very much, Commissioner. Are there any questions? Senator Anwar.
Thank you so much, Madam Chair. I just wanted to make a quick little comment that this is God's work, and I wish there was more opportunity to have more resources available. And I know that while the block grants remain flat, if there was a way to increase the total amount, because the needs of the community are increasing and the funding is flat. And that's where the area of opportunity is. And if there's anything we can do on our end, would love to get an insight on that. And thank you for the work that Commissioner you do and each and every one of the people on your team have done and continue to do every day. Thank you.
Thank you, Senator Anwar. You could write a letter to our federal delegation. These are federal dollars that are coming through. So that would be helpful. Up next is Representative Pettit.
Thank you, Madam Chair. Thank you, Commissioner. I wonder if you or some of your staff would comment. A week ago, Tuesday, the CDC came out with a report that 80% of maternal deaths from 2017 and 2019 were due to preventable causes. And they listed mental health, hemorrhage, cardiac and coronary infections, thrombosis, and cardiomyopathy. Do you think the money here is going to get to those issues in a significant way? And if not, are there other things we should do in terms of approaching the federal delegation or from a state point of view, from a legislative point of view? Thank you.
Commissioner?
Thank you, Representative Pettit. So I think, first of all, the Maternal Mortality Review Committee that we have established within DPH is at the forefront of addressing some of these issues because they come together and, review deaths and identify what the causes are. And I think that this is going to help inform potentially other legislation that may come through in this session as well in terms of addressing maternal mortality. I would also just want to make one additional comment just in terms of Senator Anwar's comment, which is all of you have been such good collaborators with us. So for example, his point about mental health, the school-based health centers, which are supported in part by some of these block grants, the funding that you put towards that, it is really a collaborative effort of leveraging funds from multiple different sources, federal sources, state sources, to be able to address those issues. So we need to continue doing work like that. Are there other people in DPH? I don't know, Mark Keenan, maybe potentially if you have something that you'd like to add, particularly on Representative Pettit's point.
Our findings within the state with our own maternal mortality review committee substantiate exactly what the CDC's findings were. The committee has made very specific recommendations, and the state has taken them up. Medicaid coverage has shifted, in part because of the efforts of that committee and others within the state system. We're getting support for the maternity safety bundles, and other training and programs through Connecticut Hospital Association and other recommendations that are going forward. It is difficult because the data set is actually very small. When you look at this, the number of cases reviewed are actually, have to be looked at over a number of years in order to really find substantial recommendations to make and to act on. But the support that we've been given is very much appreciated in this.
And I think just
The federal data suggested that the vast majority of this occurred in urban areas. Do we see the same issue in Connecticut? Is it mainly an urban issue, or is it spread throughout the state?
I wouldn't say that our findings, reflect that as dramatically. We've got rural areas that have the same concerns as we see. Definitely you see racial disparities in this group, which is a more substantial way of looking at this.
All set, Dr. Pettit? Thank you. Up next is Rep. Hughes.
Thank you, Madam Chair, and thank you, Commissioner. To follow up on Dr. Pettit's concern, do we have a racial and ethnic impact statement on either the block grant that we have that we're proposing, or the one that we've just, used that we're renewing, and especially on for policymakers, especially on the maternity and infant mortality rate in Connecticut?
Commissioner?
So you're talking about when you ask for a racial impact statement, are you asking specifically of breakdown of number of women?
Disaggregated data, yes, please.
So, there certainly is a disproportionate impact in terms of Black women that have suffered, in terms of maternal mortality. This is unfortunately a known thing. And part of the interventions that we look at, we're fortunate that our numbers are not that high, but those that exist have a disproportionate impact. And that's part of what we're looking at in terms of trying to address. We also know that many of the chronic diseases that affect the Black and brown populations, and we're talking today about obesity in general, the hunger conference that the White House is having, and obesity. A lot of these things are in many of our Black and brown communities, and maternal mortality also is in part tied to that, or consequences of that as well. So all these things are tied together. And what I would say is that our chronic disease groups, some of whom are also on this call today, also address many of these factors, maybe through other mechanisms, not only through these block grants that we're talking about today, some of it through these block grants, and particularly the first one that we were talking about. So I hope that answers your question. If there's somebody else from DPH that has an addition.
Representative Hughes, does that answer your question?
Well, we passed a legislation that gives policymakers access to racial and ethnic impact statements on proposed policy. And I wanted to know if that has been initiated.
These are federal dollars. These aren't, so that I don't know that applies to them. We should go back.
That's what I'm wondering. That's what I'm wondering, if we could get.
Let me go back and look at the legislation and see if that does that, rather than.
Okay, thank you.
Okay, thanks, Representative Hughes. Representative Abercrombie.
Thank you, Madam Chair. Good morning, Commissioner. Good morning to your staff. Thank you for being here. I want to talk a little bit about the Preventative Health and Health Services Block Grant, and I want to drill down to the local health departments. I want to say that I'm really concerned with the shift that you're going to be doing from the competitive grant, from a formula-based grant that you've been using, to a competitive grant, and I'm going to tell you why. During COVID, we've seen a lot of issues within our health departments especially some of the regional ones who did not have sufficient staff or help from DPH to be able to help the smaller districts that they were supposed to be working on. We have smaller health districts that don't even have staff to do flu shots. So now you're going to go to a tiered system, and what's going to happen to them? So I would like to see that tiered system, how you're going to decide who gets these dollars, what the basis is of those dollars, because I will tell you that I'm very concerned that the smaller ones are going to be left out in the cold, and they're the ones that we need the most right now. So that's I will tell you that that's where my biggest concern is on the black grant. Now, if you tell me that you have other resources that you're going to be putting forward for the health departments, that might be a different conversation. But at this point, that's the thing that I am the most concerned about.
Thank you, Representative. Commissioner?
Thank you. So one thing I want to just clarify from this is that from this block grant, we're talking about $1 million that will be able to go towards this tiered program that you just discussed. Now, one of the things I want to mention is that some of the health departments, and this was full-time health departments, were only getting in the range of $1,800. And we got complaints, and actually there were 15 health departments that declined getting any money at all because they felt that they could not do anything of significance with the money that they were receiving for DPH, particularly from this federal block grant. This federal block grant, as I've described, addresses specific areas of intervention that we're trying to work on. So what we're looking at going forward, and this will be an iterative process. We designed it in conjunction with local health departments. We're looking at 10 to 20 different, potentially $30,000 to $100,000 block grants that will be given to those who receive them. And they would be able to choose from a sort of menu of options. Some of the things that we've talked about would be things like, and again, working in conjunction with local health. Some of the areas that were identified as a priority for them were chronic disease prevention and management, community strength and resilience, and injury and violence prevention. And so the idea here, what we're really trying to do is there are other funds that local health departments get, but particularly in these specific areas, one of the things that this grant is intended to do is not just subsidize local health funding, but really devise programs that are going to be able to allow us to make interventions that are going to have an impact that we can measure over time and say that, a health department didn't just get $1,800 and just supplement some small part of somebody's salary, but that was able to design an intervention that made a difference and a measurable difference in terms of outcomes in our community. That is our hope with designing this program. We will, of course, as you've described, be looking out for what the downsides are. And, we will be working with them to be able to see, is it having its intended effect in terms of the way that we design the program? So I think at this point, currently, we have 39 local health department contracts that for this particular block grant. Each award is roughly, the average is $20,000. So what we're doing here is we're also incentivizing collaboration of local health departments and with community organizations. So our hope is that this will be better in the end with collaboration with community health organizations and potentially with each other to put the money to the best use to actually be able to devise interventions that are going to have measurable outcomes for us in the end. But again, it will be an iterative process and we will see how this process goes.
Representative Abercrombie.
Thank you, Commissioner. I appreciate that. And I will be reaching out to my health department, who has been very active here in Meriden, to see, if they're in agreement with this system that you want to put forward. And then my second question is, and it's more of a comment, I think it's going to be interesting next year when my colleagues have to look at the block grants again and we look at the maternity, right? Because I think that the closing of maternity wards in our hospitals is going to be a huge, huge, huge impact for the families that we represent. And I'm proud of the fact that we changed the CON and how they have to come before this body to decide if they're going to close. But I'm going to tell you right now, there are going to be huge ramifications going forward. And it's sad that legislatively, we've done a lot, right? Especially in Medicaid with the bundles and working with DPH. But now to have the hospitals take a step back, I think is going to be very hurtful to the women that we represent. So I think it's going to be interesting to see how those numbers play in next year. And it's just a comment, ma'am. You don't have to, you don't have to comment on it, but I will just say I'm very concerned about that. Thank you, Madam Chair.
Thank you. And I would point out that that's happening in the smaller communities where we're losing some of the funding for some of the health departments. Thank you. Representative Porter.
May I just make one quick comment? Would that be okay, Senator Austin, on this? I just want to, I agree.
Up to Representative Porter, because I just called on her.
Thank you.
Representative Porter, are you okay with her making a comment?
Absolutely. Go right ahead, Commissioner. Thank you, Madam Chair.
Sorry, Representative Porter. I just wanted to say, I want to highlight that in the second maternal block grant that we talked about, some of the funds are being used to provide mobile services to areas of the state where labor and delivery are being closed. I share your concern, Representative Abercrombie. That is part of the reason DPH is mobilizing resources in that way to address your specific concern. We're going to have to watch this very carefully.
And kudos to you for doing that, but those are resources that could have been used in other areas if the hospitals weren't stepping away. So thank you for doing that, because I'm sure, the women in those areas appreciate it, and my colleagues who represent those areas.
Thank you, Representative Abercrombie. Representative Porter.
Thank you, Madam Chair. And thank you, Commissioner and team. And I just want to piggyback off of what was last mentioned, because that is on my list, the huge ramifications that are going to come from the closing of these OBGYN facilities and services, and really, rural areas that are already hard to get to, right? So when we talk about the level funding and what's being given in these block grants, my question is, are we looking at doulas and midwives to step in and bridge that gap? Because Senator Abercrombie hit it dead on the nail. I mean, like that it's a prediction that none of us like, but I mean, it's basic education. We know we're going to have a huge problem, and I would really like to see us use some of this funding to get ahead of that, to make sure that the issues that have been discussed around maternal and infant mortality don't become exacerbated because of what is happening at the hospital level. So that's my first question, Commissioner.
Commissioner.
So thank you for that comment. What I would say is that not these particular block grants, but there's been a lot of effort, what you're saying in terms of expanding the workforce or looking at other areas, whether it be examining the role of birthing centers, doulas, as you mentioned, scope of practice for doulas is under review. That's something that DPH is actively engaged with. We are lucky to be having partners like with Commissioner Gifford and DSS in terms of the maternity bundle, and doulas in terms of being covered under that. So really sort of highlighting, and she can speak to that better than I can. I don't want to speak for things I don't know in great detail, but I think that this is the type of partnership and, all of state response we're going to need to address this growing concern that we all have. So these are areas that we're going to be looking at going forward, this legislative session, but even what we're doing right now, I can say that we are actively looking at a larger role that doulas can play in this landscape.
Thank you. And I don't want us to leave out midwives. I mean, I believe in back to the basics is the best advice that I've ever been given across life, right? And
absolutely,
this all started with midwives and doulas before we took maternity to hospitals and doctors. So I think it would do us good to tap into that professional field to help bridge the gap and save lives, right? Mothers and babies. And then the other thing, I've been doing a lot of research around Black maternal and morbidity rates. Black women and babies are 3 to 4 times more likely to die than their white counterparts. And as was stated by Representative Pettit, I believe, the CDC is reporting 80% of those deaths were preventable. And what's really sad about it is many of those deaths are 100% preventable, 60 to 100% preventable. So I want to know what it is we're doing specifically with this funding to address Black maternal and morbidity rates in the state. I'd also like for this, for the committees on this call to have that data, right? I want to see where we fall in Connecticut and who is being impacted by these rates. You talked about, blood pressure and all the other things that impact Black communities. But that's because Black and brown communities, you come to my district, we have plenty of corner stores and liquor stores. We don't have access to grocery stores. We don't have access to fresh fruits and vegetables. We don't have adequate health care. I could go on and on. So how are these funds being used to bridge those gaps, which are really the root causes? Because I think we tend to address, surface, what we see, instead of, delving deep and plucking things from the root. So what are we going to do with this funding to address the root causes across the board, especially when we're talking about preventative health and health services, right? How is this money going to be used to address those root causes so that we can advance maternal health in Black and brown communities?
Shall I respond, Senator Austin? Okay, yes.
Commissioner, I'm sorry.
Sorry, thank you. So I share your concern. And I think that one of the things I would say is, as I was summarizing with the preventative health block grant, one of the reasons for the tiered system that we are hoping to do is, instead of having a smattering of little amounts of money, design programs. And the number one thing that local health departments told us they were interested in was chronic disease prevention and management. So to get interventions that can actually have an impact in a community in a combined way, in a way that can really address some of these issues. That's an example of how one of these block grants is going to address that. Now, in terms of the maternal block grant, the Maternal Mortality Review Committee, the MMRC, which meets, I believe, 4 times a year, really addresses a lot of these issues. Mark Keenan, could you maybe give a little bit more, or if you want anybody else to talk about it, about the MMRC data, where that can be seen, how it can be, sort of operationalized for people?
So there is an annual report that with recommendations that come forth for the MMRC. Those things have been, very substantial as far as, review, and our state partners have been very responsive in helping us to put those recommendations forward into action through the Connecticut Hospital Association, through DSS's changes in Medicaid, all of those things. The patient safety bundles are something that we are supporting because of findings and recommendations where we have shifted some of the funding within the MCH block grant to support those activities going forward. We do perinatal case management. There's a direct perinatal case management program as part of this funding. We are working with the Hospital of Central Connecticut on a project to provide maternal support. We're looking at a lot of our sister grants that work with this. Our funding for WIC is very much involved with getting these services, people connected to services, and doing this. We have Family Wellness Healthy Start, which is focused on those same outcomes. And so the MCH block grant is one of a number of federal grants which are looking at those same outcomes.
Does that answer your question, Representative Porter?
In part it does, and I thank you for that response, Mr. Keenan. I would like to request through you, Madam Chair, the annual report be shared with the committees. And it sounds like we're doing a lot of great stuff, but I'm interested in knowing what the outcomes are, how effective we're being in our outreach and our quest to end, this great disparity among Black and brown communities in the maternal and infant healthcare system. So that would end my questions, and that would be my request, because I think if that information is shared with us, we can in turn share it with our constituents and our health departments and everyone else that could benefit from that information, because I get a lot of feedback along the lines of, you guys are doing things in the building, but we need to be educated outside the building. So if you could help us, you know, as lawmakers, get that information to our constituents, that would be greatly appreciated. And I'd also be interested in sitting in on some of these meetings. So that's a sidebar conversation we can have post this meeting. Thank you, Madam Chair.
Thank you very much, Representative Porter. And that report can be sent to our Madam Administrator, and she'll get it out. Representative Dillon.
Thank you. Good morning. And thank you, Commissioner, for your presentation. I have a question for Mark Keenan.
You got to go to the commissioner.
About
Pat.
Sorry, ma'am.
Pat, we can't hear you. Pat, we can't hear you. Your internet is not good. We cannot hear you.
I have a question for Mark. I have a question for Mark Keenan.
No, we're going to go through the commissioner first, please.
Okay, Commissioner, I wonder if you could either, if not identify today, follow up with us about participation in the WIC program and whether or not there's full participation of WIC eligibles. And we do know that the drawdown on the WIC voucher program for produce is not as large as it is for the senior produce. And there may simply be an access issue. I don't know what that is, but I wonder if you could follow up with some numbers that would be from the Agriculture Department, I guess, on whether we have full participation in WIC and WIC produce and how we address it and where they are. So that's my first question.
Commissioner, did you get that?
My second
Could I maybe
Pat,
maternal and the birth outcomes, and it really.
Representative Dillon,
Yeah.
we can't hear you.
Yes.
So we're going to let the commissioner answer your
Yes.
first question, which we think we got. So let her answer your first question, please. Go ahead, Commissioner. It's on WIC.
Thank you, Senator Austin. So in terms of WIC program and enrollment, I believe that's the crux of the question. I'm going to ask Marcia Pesolano, who I believe is on the call and directs our WIC program, who's going to be able to give more concrete numbers in terms of enrollment, because I believe there are two questions. One regarding the actual partnership in WIC itself, and then the other question, I guess, was about produce. That was a little in and out for me. So Marcia, are you on?
Hi, good morning, Commissioner. I'm here.
Good morning. Thank you, Marcia. Go ahead.
Good morning. I believe the question was about the Farmers Market Nutrition Program numbers, and those numbers do come from the Department of Agriculture, so I'd be happy to ask them to provide the redemption numbers. We're still in the process of participants redeeming those vouchers. It runs through November, so I believe the final numbers won't be available until the full program is done, but I can certainly see if they have numbers available prior to that. I can say that for overall WIC participation, our numbers are increasing. We're over 47,000 participants right now, and we are seeing increases from past years.
And Marcia, could you maybe just also touch on the collaboration with DSS and just different ways that we're working to increase enrollment in WIC that we've done particularly over the last year?
Absolutely. One of the biggest, there's two kind of key components that we've been doing recently for outreach and recruitment. The first is we've created an online interest form that participants can fill out to express interest in the WIC program. That interest form is being promoted through the second arm of our outreach strategy, which is a campaign. It's a media campaign. We've been doing social media, we've been doing TV ads, we've been doing billboards and other types of media to promote WIC, and you might have seen it, WIC is more. There's some great ads that are out and available that have been done focused in specific areas where our participation was a little bit lower. And we continue to expand on that as new funding comes in. We recently received some additional funding to continue to expand that campaign. And all of the participants that are interested are either directed to our website to contact a local agency site that's closest to them, or they get directed to our online interest form to fill that out. And we've seen, I want to say we've had about 1,500 people come through that online interest form so far since we launched in May. So we've seen quite a bit of activity through that. In addition to that, Commissioner Giuttani mentioned our partnerships with entities like the Department of Social Services, the Office of Early Childhood. We have a very tight relationship with the Head Start programs in the state. We've also partnered with some other entities like Birth to 3 recently, just to try to coordinate services and cross-refer.
Commissioner, do you have anything else you would like to add?
No, that's it. Thank you.
Representative Dillon, did you get the answers that you were seeking on WIC?
Yes, Madam Chair. I'm not sure if you can hear me given my bandwidth problems this morning, but I'll follow up later. Thank you.
Thank you very much, Representative Dillon. Representative Dathan.
Thank you very much, Madam Chair. And thank you, Commissioner Giuttani, for being here today and bringing your team, very knowledgeable. I have two questions. The first one is regarding the sort of nutritional aspect of this grant. And I know the White House is doing a conference this week on hunger, nutrition, and health. And wondering how that is tying into some of the things that we are doing under this program, because I was surprised to see how much of this grant is going towards nutrition. I'm working on a food as medicine work group right now with my colleague, Representative Foster, who sits on public health. And, this is something that's, really of interest to us, and just kind of echoing some of my other comments from my other colleagues on prenatal and young person nutrition, just to improve outcomes. And I'm just wondering how we're sort of monitoring those programs in relation to outcomes of healthy and well child postpartum events.
Commissioner, did you get a question out of that?
Yeah, yes, thank you. So first, I'd like to agree with your point in terms of, the challenges we're seeing. And I really am very eager. I've read some of the documents that have come out of the White House in terms of, obesity trends and access to food that really determines so many of the chronic diseases that we're talking about. So I think there's going to be a lot of work to do in this area. I look forward to seeing what your working group puts forward and what ideas you have. Along those lines, are there other people from the DPH staff who want to comment specifically on the question of how we might be putting any of these ideas to work right now before any new things might come forward? I don't know if Rosa or Mark Keenan, either of you.
Seems to me, Commissioner, they're all set with what you said.
Okay.
All right.
Okay, my second,
yeah,
I had a second question actually, and my second question, is regarding the substance abuse prevention and treatment block grant. And I saw your explanations about some of the decreases, but I was wondering, within the outpatient services, are any of these services peer support services? This is another initiative I've been working on in our state, and it's been very well proven to have very strong outcomes. And I'm wondering how much we are putting into that with this grant.
So the substance use block grant, I believe that's a DEMIS block grant. The only two that we have are public health and maternal.
Apologies. Yeah, I'll save that question.
Yes.
I'm
Thank you.
so sorry. Thank
No
you. so much.
problem.
Sorry, Madam Chair. Thank you.
Okay, Representative McCarty.
Yes, I apologize, Madam Chair, but I thought if I could direct this to the commissioner. I know we're talking right now about these, the allocation plan, and this is a block grant that you receive. And I'm just curious because as you look back, it looks like the categories stay fairly consistent. And I'm just wondering, and maybe this is a discussion for another time, but trying to determine how the department determines those categories and those exact figures that you're going to be allotted to each one of those programs. So just a question. I've been curious as to how you determine those primary categories going forward. Thank you, Madam Chair.
Commissioner?
Thank you. So you're right. Many of these issues are consistent, and part of them is unfortunately because they remain big and consistent problems in our community. So a survey was done of all local health departments as we entertained this new idea of trying to leverage these federal dollars as best as possible. And we gave roughly 6 different topics to see what people thought were priorities, and then allowed for opportunity to provide other free association ideas of topics. And yet these 3 still sort of came out as leading topics. So some of this is still being worked out, but I think that what we see is that some of these issues remain big, important topics when it comes to health and public health. And I think that's part of the reason for rethinking how we could leverage these federal grants is that we still have these issues. We still have these problems. Is there a way that we can leverage the funds in a way to have the most impact and measure the impact from the intervention that is done versus a smattering and sprinkling of funds with smaller interventions that may not have the impact that we really want to have. So I think that's part of the reason for trying to reimagine and rethink this. But I think your point about these stay consistent, they were made consistent to us by local health departments. And I think it just reflects the challenges they have in terms of the problems they're trying to address.
Representative McCarty, did that answer your question?
Yes, thank you very much, Madam Chair. It helps me understand that process. So thank you very much.
Thank you.
Thank you, Representative McCarty. Thank you, Commissioner. I think we've gotten through all of our commenters and questions. So we're going to move on to Demas now. Is Administrator Keen, is Demas in the room now?
Yes, ma'am. Commissioner Navarrete and her team are in the room.
Commissioner Navarrete.
Good morning. Good morning, Senator Austin and Anwar, Representatives Walker and Steinberg, and other distinguished members of the Appropriations and Public Health Committees. I'm Nancy Navarrete. I'm the Commissioner of the Department of Mental Health and Addiction Services, and I'm here to present the Federal Fiscal Year 23 allocation plan for the Substance Abuse Prevention and Treatment Block Grant. I have with me also today Deputy Commissioner Colleen Harrington, CFO Cheryl Aurora, Director of Quality and Evaluation Kyle Barrett, Chief of Staff Chris McClure, and our Director of Government Relations Mary Kate Mason. So the block grant allocation plan for 23 is based on Connecticut's funding level that was approved in 22 last year, which was $19.1 million. The Congress has not yet convened to enact our final budget for this year. So as with DPH, we plan on flat funding, and that presents minimal risk for us and allows us to plan with stability for the coming year. So to note, our SAPT block grant is only a portion of the amount of dollars that we spend in substance use. In this case, it's a small portion. Much of our services are also supported by our state allocation. So some of the activities that the block grant funds include substance use prevention, education, multiple treatment modalities, and recovery supports. I know that question just came up. 20% of our total SAPT block grant is designed for prevention activities. So there is a set aside. We meet that set aside, and that's required by SAMHSA. And the allocation plan was prepared to align with federal funding requirements while also addressing the other issues that we have in Connecticut related to behavioral health and the coming out of the global pandemic. So there are limited changes this year in 23 compared to last year, 22. Many of the changes, some of you may remember last year, were related to the implementation of the 1115 waiver, making some of the substance use residential services Medicaid reimbursable, bringing a federal match into the state. So that has been implemented. SAMHSA encourages states to utilize block grant funds for services and activities that are not reimbursable by Medicaid. So many of those changes happened last year. There's a small percentage this year, $51,000, that continued to come out of the residential services. And that's a small portion of the funding for that line. Many of those funds were focused now on recovery support services and prevention activities, such as the clearinghouse that many of you are aware of through Wheeler, the emergency department recovery coaching, our access line for substance users, transportation services, senior outreach and engagement, and recovery support programs for women. So we use the block grant to support efforts to address the opioid crisis. And our overall plan includes expanding hours for opioid treatment programs, or OTPs, in the community, increasing mobile MAT vans in underserved areas, supporting our access line to ensure 24/7 connection to services for people seeking help, recovery coaches in hospital emergency departments, mobile employment services, services and supports that divert individuals from criminal justice into treatment. So I'm happy to be here today. Thank you for the opportunity to testify, and I'd be happy to take any questions you have at this time.
Commissioner, is that the only grant that you have responsibilities for?
No, I also have responsibility for the Community Mental Health Services Block Grant.
And do you have anything to say on that one?
Yes, I do. I can go
So
right
why
into
don't
that.
you go ahead into that? Thank you.
Sure. So the Community Mental Health Services Block Grant is intended to fund mental health services for both children with serious emotional disturbances and adults with SMI, or serious mental illness. So DEMIS oversees the grant, and we share a portion of the grant with DCF. So 30% of the grant goes to DCF. We've done that historically, and we continue to do that in this federal fiscal year. Again, our plan is based on flat funding from fiscal year 22, which was $8.4 million. And again, we will wait for Congress to convene and enact those final numbers. So we use the CMHS block grant funds to supplement state funds allocated to various levels of care in our mental health system, including emergency and crisis, outpatient, clinical services, residential services, employment, case management, social rehab. Block grant funded services are provided by our statewide network of private nonprofit providers. So none of the block grant funds go to staff DEMIS positions or DEMIS state operated programs. And following the guidance from SAMHSA, we support services and activities that are not otherwise reimbursable for the most part by Medicaid. There is a small percentage that we do invest in helping folks that are unentitled or who may come on and off entitlements, and therefore there is something to support them. So our allocations are generally consistent with last fiscal year, and in keeping with the emerging national focus on emergency behavioral health services, SAMHSA just enacted a 5% set aside, which even before they enacted that, we had already met and surpassed. So approximately 39% of the funds that we receive through this particular block grant go into the emergency crisis system. And that includes not only the MCT, the mobile crisis teams, but crisis respite beds throughout the state and bringing up 988. So this block grant is a small percentage of our budget, less than 1%. However, these funds provide an opportunity to incorporate priorities based on data from local, state, and federal sources. We have a lot of input input from stakeholders, our advisory organizations, and data from our own initiatives. So the block grant funds are used to supplement state general fund dollars to address pre-existing and emerging mental health needs across the state. That is my portion for the adult side of the house, and happy to turn it over to Deputy Commissioner at DCF, Michael Williams, or take questions at this time.
We'll call Deputy Commissioner Williams to finish out the grant. Deputy Commissioner, if you are in. Deputy Commissioner Williams, are you in? Madam Administrator, do you know if he's in?
There he is.
Oh, there you are.
Yes. Thank you.
Sorry. Go ahead, sir.
Thank you, and good morning, distinguished members of Appropriations, Public Health and Human Services Committees. My name is Michael Williams. I'm the Deputy Commissioner of Operations of the Department of Children and Families. And I am joined this morning by Dr. Frank Gregory, who is our newly appointed administrator for DCF Children's Behavioral Health Community Service System, by our legislative aide, Vinnie Russo, and by Tim Marshall, who is a retired Director of Community Mental Health Services, back with us for a stint. So first, let me say thank you for the opportunity to present the department's proposed federal fiscal year 2023 allocation plan for the children's portion of the Community Mental Health Services Block Grant. The department proposes to use the funds for this block grant to further our vision for a comprehensive community-based mental health service system for children and their families. These federal dollars play a critical role in meeting the department's mental health mandate and for strengthening the mental health system in Connecticut, resulting in positive outcomes and allowing children to realize their fullest potential. The services and supports provided with block grant funding are important components of the foundational elements that DCF has embraced through the system of care model, which aims to maintain children with mental health issues or challenges in their homes and communities through both the efforts of local consortiums and the Community Behavioral Health Partnership. In collaboration with community providers and state agencies and families, the department is working to ensure that children and their families receive the care and services that they need. Similar to years past, the Community Mental Health Services Block Grant continues to provide supports and resources that are not funded by Medicaid or other sources, including access to local community-based family support and resources to enhance the quality of existing community-based services. In this way, block grant dollars are blended with other state and federal resources to increase their impact and improve outcomes for our children and families we serve. So with that, we propose to dedicate this fiscal year $3,141,453 from the block grant, supplemented by prior year carryover funds to support the following multi-year initiatives at the same funding levels as approved in last year's allocation plan, except for two changes. So the final amount awarded to us was increased by $434,000 from roughly $2 million, taking us to $2.5 million. The proposed changes reflected below.
Come here, up on the porch.
Sorry. The proposed changes reflected below include a reduction in the best practice and promotion line from $230,000 to $75,000, as well as an increase in the emergency crisis line from $300,000 to $800,000. And I'll talk about those in just a second. The areas that we have invested these resources in our service system continue to be for respite care for families who are needing the opportunity to take advantage of respite services. We invest also in our family advocacy organization for the state, a statewide agency which is called FAVOR. Youth suicide prevention continues to get significant investments from us through these resources because of the continued escalated need for preventing youth suicide. Our workforce development training and cultural competency care training continues to be a focus for us through our Kid Care Network, making sure our providers are prepared to deliver a state-of-the-art behavioral health, particularly mental health services for children. We continue to invest in developing the model of extended day treatment, which continues to be a service that is highly utilized by families and children. We also have a significant investment due to the mandate that a portion of our allocation, 10%, is set aside for first episode psychosis. And so we have that service system going with our providers to detect first episode psychosis and to intervene. We invest in our system and treatment improvement for outpatient care. As mentioned earlier, our best practice promotion, we're investing $75,000 in that. And then our continued development and continued workforce development for higher ed and in-home curriculum project to keep the pipeline of workforce available to us to do the in-home treatment work. We have a performance improvement center that looks at data and provide dashboard data to see where our system and how our system is performing. And then we do other kid care work. And then finally, as I mentioned, emergency crisis, which I will talk about in just a second. Related to best practices promotion in the program evaluation component, our funding is proposed to be decreased by $75,000 to $75,000 from which will represent a $155,000 reduction. This reduction is not a reduction in services, but it is a shift in funding sources. The ARPA dollars that have come through the mental health block grant ARPA plan replaces the dollars that we are showing as a reduction in this particular account. The services will continue to remain at the level in which they are currently operating, and there won't be any reduction in that. And specifically with this, we will have the implementation and expansion of internal school self-assessments using the National SHAPE system, which is the School Health Assessment and Performance Evaluation. And additionally, the funding will support the implementation of the National Standards for Cultural and Linguistic Appropriate Services that we call CLASS. This funding supports a variety of short-term behavioral health system needs that include fiscal analysis, promotion of linkages between behavioral health and primary care providers, and activities associated with first episode psychosis. In the emergency crisis line, the funding there, the increase is of $800,000 is what we're proposing. And this funding will continue to be utilized to maintain the costs associated with the implementation of our 988 system and the associated increased call volume to that statewide mobile crisis and suicide prevention call center that we have recently stood up. And additionally, this allocation will continue to support the regional suicide advisory boards that was created last year. And these boards are strategic community partners who work across the behavioral health care continuum. We have had to make a technical adjustment this year, which is very minor and due to an entry error when transferring the allocation plan calculation sheet to the allocation plan narrative. There was a transposition of numbers. So a technical amendment is needed in section 3 of the allocation plan, which you'll find on page 30, which basically is looking at the early serious mentally ill first episode psychosis line item. Again, the change was a numbers change that you'll see outlined in the plan. In closing, congruent with the federal mandate to transform the state's mental health system and create a comprehensive system of care, These funds are incorporated into the department's overarching strategy and vision for a broad array of quality, accountable, family-centered, racially just, culturally competent, and trauma-informed services for children with complex behavioral health needs. The services and activities funded through the Community Mental Health Services Block Grant are integral in DCF's ongoing efforts to reduce reliance on congregate care and to enhance the continuum of services available to children and families. The department thanks General Assembly for its vision for behavioral health care in Connecticut and its continued support to DCF in implementing its mental health mandates for all of Connecticut's children. Thank you.
Thank you, Deputy Commissioner. Appreciate your comments. We have a couple people that have some questions or comments for either one of you. Representative Gilchrist.
Thank you, Madam Chair. My question is for Commissioner Navarrete. Good to see you. Thank you for being here. There's been a lot of talk about about maternal mortality in our state, and according to the Maternal Mortality Review Committee, mental health conditions or substance use disorder contributes to half of pregnancy-associated deaths, and together they contribute to a quarter of deaths. And so they are recommending more interventions for mental health and substance abuse. So wondering, do any of the dollars in the block grant go towards pregnant or parenting moms? And so yes or no, and then just in general, how many supports do we have inpatient? I'm very interested in the inpatient for the parenting moms. So after a mom gives birth, do we have inpatient services here in the state?
Commissioner?
Thank you for that question. So yes, in fact, one of the priorities of the block grant is that we fund programs for pregnant and parenting folks. So we have programs across the state which are focused on substance use, and women can actually bring children with them into that program. And parenting is a big part of the curricula, along with trauma-informed care and other substance use programming. So the answer to that question is yes. That is considered residential level of care. It is not considered inpatient level of care. I don't imagine an inpatient level of care necessarily with children. We do have a representative from DEMIS that sits on that committee. So we do have a content expert that sits with DPH, who is the lead on the Maternal Mortality Review Board. So she is there to answer any questions and to follow up with services. This year we implemented what we think will be a wonderful program. It's kind of modeled after what DCF did, where we have consultants available to primary care docs, OBGYN, when a woman shows up, let's say at an FQHC or at her PCP or OB, and there is a suggestion that there might be a substance use disorder or mental health disorder, then there is immediate access through Beacon Health Options to get consultation and follow up on that case. So we're really excited about that program as well.
Fantastic. Thank you.
Are you all set, Representative Gilchrist?
I do have one follow-up since we have both DEMIS and DCF here. How does it play out in terms of like with DCF potentially having to take the child, because of the drug addiction? Is there an agreement there so that a woman can go into services with a newborn?
So there is a very strong collaboration with DCF. So usually women that are in the programming that we have across the state that is specialized in this population, we are working hand in hand with DCF to do whatever is possible that is mostly recovery focused, and ensuring, of course, that the child is safe, but at the same time working on the mom's recovery. And there's lots of supports around the mom, even when she leaves that treatment environment.
Thank you. Thank you, Madam
Commissioner
Chair.
Williams, do you have anything to add to that?
Yes, I definitely do. As Commissioner Navarrete has said, that the partnership is very strong, particularly in cases like this where child safety is our primary focus. We definitely invest in medication-assisted treatment for those parents. We know that's a major motivator for their recovery if their child is with them while they go through treatment. And so past practices would have dictated a potential immediate removal, where current practice and best outcomes show that if children are placed with parents while they're getting treatment, the likelihood of success for those parents is pretty high, and children stay safe during those circumstances as well.
Representative Gilchrist, did that answer your question?
Yes, very helpful. Thank you, Madam Chair.
Thank you. Thank you, Commissioner. Representative Dillon.
Good morning. Thank you. I'm hoping that some of my bandwidth problems are resolved here, but do let me know, Senator, if I'm not audible. Good morning, Commissioner. I have a question about returning women military. If you recall, we added a very modest amount of dollars to the military support program because we've learned nationally that suicide rates for returning women veterans are higher than expected, and that some of the support systems in place are more effective for men than for others, that is, than for women. That is, women are more likely to be survivors of sexual assault.
Pat, do you have a question?
Has the department contemplated partnering with Yes. Has the department contemplated cooperating with the suicide prevention effort?
Oh, yes.
For women veterans.
Thank you.
Navarrete.
Thank you for that question. So we're in the process of implementing, as you said, that expansion that happened in the last legislative session that is focused on returning women. So that is definitely in play. We also are a part of the Suicide Advisory Board and co-lead that with DCF. DCF is the lead. And as part of that, really have a strong collaboration with the veterans and our other efforts around returning veterans. So that is definitely a part of, it's a subset of the folks that we reach out to. We take part in many of their events. We have clinicians on site when they have events, and try to get out the message about the confidential counseling that is available through the department. So thank you.
Representative Dillon, did that answer your question?
Yes, Madam Chair. The second question?
You're very hard to hear, so if you could just ask the question, that would be great.
Thank you, Madam. The question is about access to substance abuse treatment for pregnant and postpartum women, and it's really along the lines, I believe, what Representative Gilchrist asked in terms of its impact on.
You're very hard to hear, Representative Dillon.
Mental health. Am I to understand that you're increasing your efforts to include that in your prevention efforts?
Representative Dillon, it's very hard for us to hear you. Commissioner Navarrete, did you get anything out of that?
I don't think I got the question, other than the pregnant and parenting women effort is a part of our overall 1115 waiver project. So in that regard, services have been opened up to Husky A, B, C, and D, whereas before it was Husky D. So there should be a little bit more flexibility in terms of who can get admitted to services. So we will report back once we have some data on that project.
Thank you,
Thank
Commissioner.
you.
Representative Dillon, did that answer your question?
Yes.
Thank you. Representative Dathan.
Thank you very much, Madam Chair. I'll be quick. I appreciate you touching on those peer support services that we talked about earlier. That's great. The question I now have is on the prevention and health promotion. I know you said that the decrease was reflecting in the change in the payments, but it's pretty material. It's nearly 25% decrease. And so I was just concerned about that in light of marijuana legalization and other things that we have going on in our state. So do we have any metrics around the people that are helped in this block grant, what ages they are, and how this program might be different than other programs that I know that Demas has been working on in relation to legalization?
Sure. So a couple of things. In Table C of your packet, there is a list of numbers served. So you should be able to access that. And I do want to assure you that the negative number is true. It's a quarter payment that was actually paid out in the federal fiscal year 22 instead of federal fiscal year 21. And when to account for that, it shows level funding across all 3 years.
Thank you. Did that answer your question, Representative Dathan?
I'm sorry, I don't see Exhibit C in the paperwork that was sent yesterday, and maybe I'm missing that. I'll have to have a look around. But I just want to understand, what is the difference in the programming that's done under this block grant than would be done as proposed through the prevention services that we have going through our general fund?
Okay, so oftentimes it's a braided funding in all of the projects that we do. In this particular case, through the block grant, there is a particular focus on inspecting retailers. So that project that we partner with youth, train the youth, folks go out and try and buy cigarettes and other products. And we have adults that are following behind them to work with them. And we also are doing a lot of education to those retailers, so not to sell to folks that are under 21. So that's a project that the federal government, for example, is extremely focused on and would not be as focused on the state side. Other things like promotional efforts, media campaigns, the clearinghouse, that's braided funding across both the state and the federal resources.
Okay, thank you. Yeah, thank you so much. I'll have a look for that other thing. It's probably my email that I missed. Apologies. Thank you so much, Madam Chair.
Thank you. Representative Abercrombie.
Thank you, Madam Chair. Thank you to Commissioner and Deputy Commissioner for being here today. I just want to take this opportunity to really let my colleagues know about the relationship between Demas and DCF. You know, during the pandemic, we had a lot of women who had COVID and then delivered, and a lot of those women had postpartum. So you have the Demas piece of it to try and help these women, and then you have people that call DCF on these moms who had to go in and investigate. And I will say that I know of a particular case in my area where I will give kudos to DCF that they were very, very responsive and also really looked into what the issue was, right? Because postpartum is very different from mental illness per se, right? And so I just want people to know, on my colleagues to understand that they really worked together and they really took it to another level to make sure that they were not taking children away from women that really had no control, because COVID made them deliver early and then they went into postpartum. So I just want to say thank you to both of you for your work, because it, you know, we're still finding the effects of COVID, and we're still seeing what's happening with our families and especially pregnant women. So thank you to both of you. Thank you, Madam Chair.
Thank you, Representative Abercrombie. Representative Steinberg.
Thank you, Madam Chair. I want to follow up on Representative Abercrombie's comments. For all the commissioners and deputy commissioners here today, the public should be aware of how important so many of these programs are. They're small in many cases, but they fill a lot of gaps. And what I think is most impressive is the thread that's going through all of them, that we're being thoughtful. As Representative Abercrombie said, we're learning from COVID. We're looking at programs that are effective, repurposing dollars in the right directions. That's very important. That's what government should be doing when we're operating properly. I actually have a very simple technical question. Deputy Commissioner Williams alluded to an amendment related to an incorrect number. I just want to make sure that when we vote today, is that number reflected in the proposal before us, or do we require an amendment to get that number right?
It is my understanding that an amendment is not required, but I'll let chairs answer that.
Madam Administrator.
Thank you, Madam Chair. Representative Steinberg, the three committees in their motion to approve, well, the Public Health Committee will go first. In the Public Health Committee's motion to approve the plan, the motion will be to approve with the technical correction. We are referring to this as, since it was merely a typo, as a technical correction rather than an amendment.
Thank you for that. I want to make sure we get it right when we get to that point. I was unaware of the hiccup before, so now we'll do it right the first time. Thank you, Madam Chair.
Thank you, Representative. Representative Porter.
Thank you, Madam Chair, and thank you to the Commissioner and Deputy Commissioner for your presentation. Quick questions. One relating to the fact that we definitely have a heroin problem, right? Dependency, and how it's a major health and social problem issue that was referenced earlier when it comes to maternity and parenting in particular. And I wanted to know because there's two different things going on, the methadone and the buprenorphine, I think I'm pronouncing it correctly. And I want to know if any of this funding is going to be used to actually bring more of the latter to communities of color. And I ask that because it is being heralded as the new dawn for treatment, right? Heroin treatment. And it has less abuse potential and lower overdose risks. And in communities and districts like the one that I represent, we all know that that is a big issue going on right now. So could you just speak to what the access and availability will be in having choices when it comes to treatment around heroin?
Sure. So we feel, as you do, that we can't sit back and wait for people to come through our doors, that we are very proactive and we need to meet people where they're at in their communities. We have funded vans throughout the state of Connecticut to go out and talk to people about substance use, talk to people about induction onto buprenorphine, as you mentioned, and we have made that available in this mobile fashion. So that is happening. We are also working with DPH. The federal government is now allowing us to start up methadone vans. And so we're working with DPH on regulation regarding getting that started as well. So we are definitely on top of that. We also have programs like Amani Breakthrough, which are really culturally specific. We've been working in towns like New Haven and I believe Bridgeport and New Britain to bring specialized curricula through faith-based communities that engage people in conversations about substance use and break down stigma and then make treatment resources available to them. So trying to attack it on all different fronts.
Thank you for that response. And you talked about stigma, and that is really, why I'm asking this question, because, methadone clinics definitely come with a stigma. Many in my community, I won't speak for all communities, we're struggling with them and the impact the negative impact that they have on our communities, our families, our children. And I know that with the buprenorphine, that is actually something that can be prescribed. You can go into your doctor, you can pick up a prescription, you can go like you do for any other kind of treatment that you're receiving when it comes to being medically assisted by prescriptions. So that is really the point. I appreciate what you're doing around the mobile van and methadone, but I want to stress that I feel that, you know, our communities are being left behind and put in compromising positions because they don't have the same access to this buprenorphine as other communities do.
Yep. And in fact, we've been working with our providers, I'd say over the past 5 years, and all of our methadone providers are also buprenorphine providers. So there is a choice. Folks can choose the medication that is best for them. And even though you may know of a provider that historically has provided methadone, they now offer buprenorphine as an option as well.
Okay, well, that's something that I'll delve into because that was not one of my realizations. And I think we need to definitely have more education in communities of color around, you know, methadone versus the buprenorphine and what that entails. And then the last thing that I wanted to go back to something that Representative Gilchrist had talked about around half the mental health and substance abuse is related to the maternal infant mortality. Now, Deputy Commissioner talked about supports that are in place post treatment. And I just wanted to know if you wouldn't mind, Deputy Commissioner Williams, just expanding a little bit on what those supports are.
Sure, and thank you, Representative Porter, for the opportunity to address this. The field of child protection has evolved quite significantly since the days of the crack cocaine epidemic, where foster care numbers, you know, rose quite significantly because the only intervention was foster care and removal from child protection agencies like ours, due to treatment technologies that currently exist and better ways of looking at this and putting child well-being at the center of our interventions. We realize that the best approach for us to take is a treatment approach for parents, trying to preserve parental parent-child bonding, not at the expense of safety, though. Again, our primary focus is to make sure that children remain safe. And we've found that if, again, we invest in early identification during the pregnancy of the parenting person and at the time of delivery, have services there to assure sobriety and support through facilities and treatment organizations that allow parents to go in to get services while getting treatment, and then post-discharge at home, intensive in-home substance abuse programs such as family-based recovery and other kinds of recovery programs that are designed to serve families and children in their home, very young children in their homes, to promote their recovery and to maintain their recovery while working with us to make sure safety continues to be a primary focus of the intervention. Those programs have worked, and we don't see the swelling of foster care roles in this epidemic of opioid addictions that we saw in the past, due to the way in which we now are thinking about the best way to treat.
Thank you, Deputy Commissioner Williams and Commissioner Navarrete. I appreciate your input and your feedback on those questions, and look forward to working with you both moving forward to address the issues and concerns of our communities. Thank you, Madam Chair.
Thank you. Representative McCarty.
Yes, thank you, Madam Chair. And very quickly, Commissioner, if I may, first of all, thank you for the work with Demas putting the RBHAOs into statute. I think that was very important. But could you just explain, so the emergency crisis line has been increased. It looks like it's up to 800,000 with a $500,000 increase. What role do the RBHAOs have now with the Suicide Advisory Board? And is some of that money in that line also dedicated to the RBHAOs, or is that only on the line that we see for the administrative piece. I'm just trying to understand what the full amount of funding that the RBH, and I'm sorry for shortening it, what their full allotment will be and how that relationship is working with the suicide advisory boards. I think this is such an important distinction.
So as it relates to the block grant, you should also know that they are key players. They are boots on the ground for us in our Behavioral Health Planning Council, which is one of the major oversight and advisory voices to the planning of the block grants. So that has not changed. Their role, generally, they serve on our state board, they serve on the Suicide Advisory Council. They have a big presence and their voice is heard in different ways. This amount of money, this 198 that is on the substance abuse prevention and treatment block grant, is not in any way related to the RBHAOs in this instance, but their role has not changed. This is a very small amount of money to add on the substance use side. We imagine that some of the calls coming through 988 are going to be related to substance use. We want no wrong door, and so that's what this $198,000 is for.
Does that answer your question, Representative Hardy?
Yes, and I can follow up, but I was just really trying to understand the full allotment, that the full amount of funding that the RBHAOs would be receiving going forward. And I appreciate the commissioner explaining their role and the good work that they do, just trying to protect. And thank you for that explanation. Thank you, Madam Chair.
Thank you. Representative Lee.
Thank you, Madam Chair. And I want to piggyback also, first of all, thank you, Commissioner and Deputy Commissioner, for being here. I want to piggyback off of Rep. Porter because she was talking about some equity issues, and I started thinking about your providers, and I was just wondering how many of the providers that will be administering, that treatment have people on their staff that speak other languages. People who speak Spanish. I can think in Bridgeport, we could use people who speak French Creole, Arabic. How much attention do you pay to make sure that your providers are speaking other languages and reaching out to those communities?
Well, I can give you one example specifically related to the block grant. And thank you for that question. So in bringing up 988 and the action line, we really wanted to ensure that there was a Spanish action line. So if someone calls and they're monolingual and they need access to services, we have, and we're keeping separate data on that. So that is available to that specific population. We make sure that we staff our, to the extent that we can, in a health care crisis, as you know, but we do make those services available in multiple languages.
Thank you. And I'd love to see that data at some point. I just think it's important knowing, what's going on in Puerto Rico and other places where we've gotten really bad hurricanes. We know people are going to be coming over, and sometimes they have the same issues that we have here. And we want to make sure they're getting treatment the same way that folks that have been here are. So thank you.
Thank you.
Representative, no other questions? Deputy Commissioner and Commissioner, wouldn't mind hanging out. Up next, we have Commissioner Gifford. Commissioner Gifford, I think we just have the fiscal part of grants that the block grants that we have already talked about. Do you have anything else to add on those particular?
Madam Chair?
Yes, ma'am.
So DSS has two separate distinct block grant allocation plans.
Okay.
Social services and community service.
Thank you.
You're welcome.
Just trying to speed it along. Commissioner Gifford?
Sorry to disappoint you, Senator.
You have no idea how disappointed I am. Go ahead, ma'am.
I will be brief, Senator. Good morning to you and to all the members of the Appropriations, Human Services, and Public Health Committee. As Madam Administrator mentioned, we do have two block grants before you this morning. The Community Services Block Grant and the Social Services Block Grant. These are annual renewals, and and neither contains very significant changes from prior plans that you have approved. So maybe this can be brief. Both of these block grants are provided through the U.S. Department of Health and Human Services, Administration for Children and Families, and for both of them, DSS is the primary agency that administers them. I'll start with the Social Services Block Grant first. This block grant is a flexible funding source, allows states and territories to tailor social services programs to their particular needs. The plan before you on the Social Services Block Grant forecasts a 2023 block grant funding of $17.4 million. Like all of my fellow commissioners and like our heating assistance block grant, that is based on current year's funding since we don't have a federal fiscal year budget yet for 23. In addition to the $17.4 million we estimate as the base grant, we are estimating carry forward of $5.7 million for a total block grant plan that you have before you of $23.1 million. The major use of the funds, this provides funding for services in 12 of the allowable 29 federally defined service categories. These services include case management, counseling, employment, family planning services, pardon me, home-based services, home-delivered meals, independent and transitional living services, legal services, protective services for adults, special services for people with developmental or physical disabilities, and the complete listing of categories is found in Table A on page 9 of the plan. As I mentioned, these services can be targeted by individual states for their own particular population, and we have chosen to target on where we have seen gaps working with our community partners for particularly vulnerable populations. With the exception of employment services and home delivered meals, recipients of these services must have an annual income no higher than 150% of the federal poverty level or $41,600 for a family of 4. Our proposed expenditures were in 22, were $17.4 million. And as I mentioned, we propose a similar amount for the upcoming year. The allocation plan also includes distribution of these funds to our sister state agencies, including Department of Aging and Disability Services, Department of Housing, Department of Labor, and the Department of Mental Health and Addiction Services. We allocate these funds through contracts or subcontractor agreements with approximately 31 private nonprofit providers. I'll highlight 4 minor changes in the plan. First, in family planning services, the 23 plan removes a one-time funding increase that we had during the pandemic and returns the allocation amount to the 2019 level of $890,000, the pre-pandemic levels. On home-based services, the fiscal 23 plan proposes to allocate $1.7 million in support of the current program. This does represent a small decrease of $350,000 from the 22 proposed allocation, but it reflects actually a $16,000 increase over the 22 estimated expenditures. In other words, we have had underspending in this category, so we're realigning the allocation to the actual spending. And we're taking that $150,000 and reallocating it to home delivered meals. So that will go up by $150,000 in order to offset the increased cost of food due to inflationary pressures. And finally, in the other services category, the 2023 proposed allocation of $1.28 million includes $270,000 for 2 positions at DSS to support program application and payment processing in DSS's home-based services. And as I mentioned, we've had underspending in the home-based services, not because there's not a need, but because of staff limitations at DSS. So we're proposing to up our staff so that we can make sure that we are getting as many of those services as we can out to the community. The proposed 2023 funding levels for all other line items are not anticipated to result in an expansion or reduction of services and are identical to the funding levels proposed and adopted in the fiscal 22 plan. So that is the, pardon me, oh, I get my, that was the social services block grant. Moving on to the community services block grant, also known as CSBG. This block grant provides funding through to state and local communities working through community action agencies to reduce poverty, revitalize low-income communities, and empower low-income families and individuals. We are grateful for the partnership of our community action agencies and their association, CAFCA, for the administration of this program. In terms of estimated funding, in fiscal 22, federal fiscal year 22, nationally, the funding for this program was $755 million. We are again proposing and estimating level funding for this program. And so we have proposed a funding allocation of just under $9 million, $8.966 million, equal to last year's. And in addition, we anticipate about $4.9 million in carry forward for the coming fiscal year. HHS requires that 90% of this community service block grant funds go to community action agencies or other eligible entities. So 90% of this funding does go to our CAAs. The remaining 10% is for administration and discretionary projects, and those are outlined in your documents. Each of the allocations to the community action agencies is also both in our written testimony and in the proposals. And each will be receiving approximately between a 1 and a 1.5% increase based on this allocation. The programs that are administered by the CAAs, as you all know, include but are not limited to energy assistance, water assistance and weatherization, housing and shelter, employment and training, early childhood education, financial education, case management, and food and nutrition services. And the CAAs work in partnership with other service providers, businesses, faith-based organizations, and the advocacy community to help low-income people lead more secure lives. The administrative funds are used by the department to support the staff needed to oversee and monitor the program, consistent with our federal requirements. That is a quick flyover, Senator, of both of our block grants. And I'm joined by Dorian Long, who oversees our social work program, Peter Hadler from Program Oversight and Grants Operation, Cassie Norfleet Johnson, who oversees the CAA contracts and programs, and other skilled and knowledgeable individuals from DSS. And we're here to answer your questions.
Thank you, Commissioner. Representative Gilchrist.
Thank you, Madam Chair. So good to see you, Commissioner Gifford. My question has to do with the family planning and the reduction of that one-time increase. Was that one-time increase in response to Connecticut's cuts to the Title X? And if so, have we gotten back up to the level where reducing that will be okay, or will we be limiting services?
No, yes. This was part of the response to reductions in Title X funding. And also, I believe it was a response to a decline in services that happened over the course of the pandemic and inability to provide in-person services or very early in the pandemic. And both of those have rebounded, so we don't anticipate any cuts in service as a result of this change.
Great, thank you. Thank you, Madam Chair.
Yeah, how you doing?
Thank you,
I put some
Representative.
tires here recently, I don't have an accountant here, but
So that's Representative Baker. Thank you. Representative Case. I think I missed
Thank you,
somebody
Madam
too.
Chair. I just had a few questions, and I noticed
You had
that
two
the
questions?
Commissioner was.
You had two?
Yeah. I
Two
saw
questions?
Rep. Abercrombie ahead of me if she wanted to go first, but okay. So the quick question was, is yesterday's meeting when we talked about the CAAs, what is the explanation on the formula from 1996? Do we have that explanation on how those CAAs are funded through that?
Yeah. So Cassie and Peter will provide the details. I will just tell you, though, Representative, that the statute requires that the formula be devised in partnership with the community action agencies. So this funding distribution was developed in collaboration with the CAAs. We have not had any complaints that I'm aware of from the community action agencies about the allocation formula. So as to the numbers and the actual, relationship to services provided and population, I'll let Peter or Cassie respond to that question.
Thanks, Commissioner. I will hop in very quickly. Hi, Peter Hadler from DSS. Hi, Rep. Case. We do have some data that we can share with you that will give you a breakdown of the way that the Community Services Block Grant funding is the percentage allocation to each of the agencies. As the Commissioner has referenced, we do, we finalize these numbers and have used similar numbers over time based on agreements with the community action agencies. So there hasn't been expressed concerns about the way that this particular funding has been allocated. We think that it actually is still quite close to the number of the population bases in each area. There are some slight, depending on how you want to set a formula, you can always adjust things slightly, and some folks' funding will go up slightly and some will go down. But we haven't heard concerns that this particular funding stream is out of balance with the needs of the community action agencies. So we're happy to share some data about the percentage breakdown and give that to you for your review.
Thank you. And just a comment on that, New Opportunities is the CAA up here. But when you go farther north, it's a CAA out of New Haven area that sponsors up towards Kent in that way. So it's really a strange map. So it's hard to pick out the northwest corner. And my second question is, with the $5.6 million or $6 million or so that's still in this grant that we have that's not expended, is there any monies or is any of that available to eliminate this 5 hours of time that we're looking at on Tuesday to close these offices? Because by closing these offices to do paperwork is only going to make it so that our offices get more phone calls because they're going to wonder why DSS isn't answering.
Representative, I'm happy to address that. The short answer is no. We would not be able to use CSBG money to fund DSS operations for eligibility and enrollment. But I would be happy to set aside time with any members who would like to talk about the closure. I'll say a couple of things very briefly. First of all, it's temporary. We anticipate reopening to normal foot traffic. We are open now to foot traffic for people who have urgent issues and need documents, et cetera. The office's doors aren't locked. But we anticipate going back to full services on Tuesday afternoons in early to mid-November. So A, it's temporary. B, the reason behind it is to improve customer service. So if our theories are correct, Representative Case, which of course we think they are, but time will tell, we anticipate fewer phone calls as a result of this closure. The reason why is because we have the same staff that does that answers the phones, that does in-person services in our offices, and that does the processing of the behind-the-scenes work that's needed to actually move applications forward and get people their benefits. What we have seen is about a 90% increase since June in those quote unquote tasks that we need to accomplish in order to process benefits. And when those tasks aren't processed, then applications are slowed down. People don't get their benefits when they expect it, and they start calling us. So we've also seen a 75% increase in calls. And when we talk to our staff out in the field, what they tell us is, we're getting calls, people just want to check, are you working on my application? And if we could get those tasks done, work down the backlog of tasks, people wouldn't have to call us. And of course, we don't want people to have to call us just for a query. We want to be able to get their applications processed. So the goal behind this this temporary change, is to actually improve customer service. Couple other things we're doing very briefly is we're working to automate as many of those tasks as possible so that our staff can spend more time with our clients. We are hiring. We have about 150 people that we're working to onboard right now, and another round of hiring to fill about the 230 or so vacancies that we have in our field offices. And finally, we've started what we call our first touch for calls, which is we have a very rapid call answering service at the beginning, so you don't have to wait through listening to all of the options and wait to get through to our service center. We have a very quick rapid response team that's answering calls that is able to handle between 30 and 50% of the questions that people call with. So we're working very hard to work down this backlog of tasks, automate the tasks, and get people's services out to them. And as I said, anticipate in November going back to our previous schedule of operations. But we're happy to set aside time with people to talk more about this issue if you'd like.
And I appreciate that in the comment. I just thought that by automating a lot of the services, we would eliminate a lot of the paperwork. And it seems that we're creating more paperwork because more people are able to sign in. Right.
Yeah,
and
I
think it's be interesting to know how many are still working remotely. And if we work in the office, are we able to work together to get more paperwork done faster? And I'll leave it at that. Thank you, Senator.
Thank you, Representative Case. Representative Porter.
Thank you, Madam Chair, and thank you, Commissioner Gifford. Quick question. I wanted to go back to, you were talking about the income levels, and I wanted to make sure I heard you correctly. Did you say the threshold was $41,600 for a family of 4?
That's correct. 150%, 125%. Sorry,
Okay.
Community Service Block Grant. Let me make myself clear. Community Service Block Grant, the CAA network, is focused on individuals at or below 125% of the federal poverty level, which is about $35,000 for a family of 4. On the Social Services Block Grant, with the exception of the employment services and the home delivered meals, that's 150% of the FPL.
Okay, so thank you for that.
Sure.
And you mentioned inflationary pressures, which is something that we're all dealing with. The price of everything is going up except for the wages. And I mean, with inflation being what it is, there's actually a wage decrease when you compare it to what people are paying to purchase whatever it is they're purchasing. Is that being considered? Are we looking at making any proposals about addressing that through this threshold? Because $41,600 is not the same $41,600 it was pre-pandemic, pre-COVID.
Yeah. Well, these are federal poverty level requirements, and they do adjust. The federal government every year around this time, actually, I think, adjusts what the federal poverty level is. So these numbers will float, Representative, based on what the feds decide is the FPL for that particular year. My guess is, Peter and Cassie, correct me, my guess is that this 125% and 150% are federal requirements that come with the expenditure of these funds. So we don't have the flexibility to alter that, but the numbers themselves will float based on the federal determination of the FPL level.
Thank you for that clarification. And that certainly means a conversation with our congressional people, because I do believe that's something that needs to be addressed. And that's what I'm hearing from my constituents. So thank you for the clarity and for putting that on the record. Thank you, Madam Chair.
Thank you, Representative Porter. Representative Abercrombie.
Thank you, Madam Chair. Good morning, Commissioner. Good morning to your staff. Thank you guys for being here. First of all, kudos on the home meals. I don't think that the 150,000 is going to be enough. So I'm hope we're monitoring that, because, you know, our seniors can't afford to go without those meals, but kudos to taking some of that funding there. Family planning, I'm very concerned about a decrease there with the environment that we're in nationally. I think that you're going to see the numbers going up for our young women, and I think they should have the ability to know what their reproductive rights are. So I think you need to monitor that also. I'm concerned that you're decreasing that, even though it's an increase from last year, but I think that's something you're going to have to monitor. My biggest question has to do with the caseworkers at this point. What's going on with that? Are we currently also closing the office on Wednesdays for a few hours for employees to get caught up on phone calls and paperwork?
So when you say caseworkers, Representative, you're talking about the eligibility, sir, our eligibility staff in the field? Yes.
Yes, ma'am.
So we have had what we call processing Wednesdays for about a year now, maybe more. So we have been doing the processing of these tasks on Wednesdays for quite some time. And at the same time that we did that, we were able to, as we shared with you at a recent MAPOC meeting, we were able to significantly both work down our backlog of tasks, which again, doing these tasks, it sounds prosaic and mundane, but doing these tasks is actually gets people their benefits. It's work that has to be done. At the same time we were doing processing Wednesdays, we brought our call wait times down to our goal of under 10 minutes, and we brought our unprocessed tasks down. I will tell you that when I arrived at the Department of Social Services, there were hundreds of thousands of unprocessed tasks in our system. And I set a goal, and our team has been working diligently to eliminate that backlog of unprocessed tasks. Last summer, we got it down to under 20,000 unprocessed tasks. They come in by the tens of thousands every week. And so we started, as I mentioned, we started to see those unprocessed tasks creep back up. And many of the phone calls we were receiving and the visits we were getting in the offices were people checking on were my tasks being done or not. So I appreciate and understand the concerns. What we're trying to do is balance the need to answer the phones, see people in person, and get those tasks processed, meet all of our federal requirements in terms of timelines for application, determination, and most importantly, get people the assistance that they are counting on. So I understand your concern, Representative. Like I said, this is a temporary measure that we need to take. Very importantly, as we enter the public health emergency unwinding, we don't want to have a large backlog of unprocessed tasks because that's going to just exacerbate the problem.
So with all due respect, Commissioner, I understand that. I am somebody that does field trips. I have been to DSS offices. I have seen the process. I get that. But at the end of the day, that's DSS's job, is to have people there when our constituents come in and need and have needs, right? You're a needs-based agency, right? So now you've got Wednesdays that your office is closed to people walking through the door, and now you're adding Tuesdays to that, right? There are discretionary ARPA dollars that, in my opinion, you should be using for overtime to get those numbers down versus closing your office from now until November, which is 6 weeks almost, right, of not being able to deliver these services. I get it. We're at almost 1 million people in Medicaid. I get that there's a lot of paperwork, but that's part of the system. And I get that you're trying to do as much as you can online, but at the end of the day, you're closing the office twice in a week for people that need to be able to come in and get these benefits. So I would strongly urge that you think of another process for these workers to be able to do their job. And I know how hard they work because I've seen it firsthand, and I'm supporting them without having to close the offices. I think it's ridiculous that you are going to be closed 2 days in a row, even though it's 5 hours each day, when our constituents need to come in and get these services. So,
Representative, we all have the same goal. The offices, just to remind you, the offices are not closed, the doors are not locked. People can come in, they can drop off documents, they can pick up documents, and there are people there to greet them and answer their questions. But our processing staff are catching up on processing their applications. You know, with the 150 people that this is not a financial issue. I want to make that very clear. We offer overtime both in the evenings and on weekends. We don't have enough staff taking up our options to do overtime to work down the backlog of these unprocessed tasks. So, you know, we have to strike a balance between getting people their benefits, which is what the main thing we all want to do. I just want the public to know, if people are listening, people are not taking this time off. First of all, we're open in the morning. Anybody who calls and is still on the phone, they will be helped in the afternoon on Tuesdays. But what people are doing, what we are doing on that Tuesday afternoon and Wednesday is actually the work that's needed to get people their benefits. So this is a temporary situation while we ramp up our hiring and work back some of the backlog that has accumulated over the past couple of months.
how long is the training for these 150 employees? How long does it take to train somebody for this particular process?
It takes several months to fully train our eligibility staff. Representative Abercrombie, one of the things that I mentioned earlier was this first touch phone process that we have, which is handling some of the simpler phone calls. In addition to our mobile app that we're working on expanding every single day. And one of the things that's going to change in November is that we're taking some of these new trainees and instead of having them have a much more prolonged training period, we're going to get them on the phones right out of the starting gate and answering some of these simple phone calls, which will accomplish two things. It'll bring them up to speed more quickly, and it will also give us more staff in our first touch phone room and help us handle more phone calls. So that's when we get those new trainees on the phones in November, that's when we anticipate being able to shift back from this temporary situation because we'll be able to handle more call volume.
So let me just end with this. I appreciate all that you've said today. I appreciate what you and your agency are doing. I'm just going to be frank because you guys know I'm frank. I don't think it's enough. I don't. And I think that my constituents that are on this Zoom, you've got public health, appropriations, and human services, we're going to get the calls. We're already getting the calls, which means we're going to be reaching out to your agency. So I'm just forewarning you that this is a tsunami coming, and I don't think that the solutions that you're putting forward are going to be good enough for our constituents. But I do appreciate your agency. I do. I've worked with you guys for 16 years. I know how hard your staff works. I know how hard our offices work. But I think in this particular situation and the climate we're in, as a state and as a country, it's just not going to be enough. So thank you for your time.
Representative, I appreciate your opinion. I welcome any other concrete suggestions that you have for the department.
Thank you, ma'am. Thank you, Madam Chair.
Thank you. Representative Johnson.
Thank you, Madam Chair, and thank you, Commissioner, for your work. Can you hear me all right?
Barely, but go ahead. Looks like you're muted, but there you go.
I'm sorry?
You're all set. Go ahead.
Am I okay? Okay. Thank you, Senator. My question has to do with the allocation of funds for the Temporary Assistance for Needy Families program. And I seem to have a great number of people here in my district who are homeless and going and living in the Holy Family Shelter. And I'm concerned about that allocation and wondered what kind of data do you have with respect to families that go on TANF, are put off of TANF after 21 months, and then end up in a homeless shelter?
So just happy to answer Representative Johnson. Just to be clear, we're not, the Community Service and Social Services block grants are wholly separate from the TANF program. So it's separate, although obviously serving overlapping populations, separate funding mechanisms there. I'm not aware of our ability to track people who come off of TANF and then end up in the homeless system. I don't know that the Homeless Management Information System collects data on previous, TANF recipients or not. So we probably can't answer that question specifically. Obviously, we work very hard with our TANF participants to provide them with job training and other resources that they need to remain economically self-sufficient after their period of funding is over. And we also obviously share your concern, particularly about families with young children who face housing instability. Part of the funding that we have here in our social services block grant goes to the Department of Housing to provide emergency shelter. So we certainly share your concerns, and Peter in particular has been working very hard on ways that we can continue to enhance the TANF program to make sure that the transition off of those services is as smooth as it can be for those families.
I have had concerns from a lot of the subsidized housing projects in my district, where once the 21 months runs out, they run into problems of being able to figure out a way to find money to pay for rent. And oftentimes they get evicted. At the end of session last year, I had 55
Johnson
who were evicted because of the limitations that they had with respect to funds. And my second question has to do with
Representative Johnson. If we could stick to the questions relative to these block grants, we are over 2 hours into this, and we still have many more people to come and speak in front of us. So,
thank you so much, Senator. And I have another question with respect to the automation that's occurred. The scanning of the documents for review by the staff is a problem. It seems to me that I've been in contact with a number of clients of yours and constituents of mine in my district that have had scanned documents, and then they are unable to get a determination from the workers. And it doesn't seem like there's a way for them they have to keep going back and having the documents re-entered. I just wondered if if you're familiar with that issue.
Anecdotally, I am representative and share your and our clients' frustration when they submit a document that's scanned and then have to resubmit it. I think honestly, the challenges that reach my level, many of them have to do with that particular issue. We are working on further automation of our processes. That's the ultimate solution. We have still too much that's paper-based and still too much that requires a PDF to be scanned and then reviewed by a human. I will say, back to the back and forth I was having with Representative Abercrombie, reviewing these scanned documents is one of those tasks that has gotten those task numbers that have gotten bigger over the past couple of months, we have to have staff available to look at those documents, see what information is contained in them, and then process the eligibility decision based on it. So some of those complaints you're hearing are in fact tied to why people need to come into the office, why people need to call. And that goes back to the reason why we are giving staff some additional time to process tasks on Tuesday afternoons.
Okay, thank you so much for that. Thank you, Senator Austin. Thank you, Commissioner. Appreciate your work.
You're welcome.
Thank you. Representative Case for the second time.
Yes, thank you, Senator. Commissioner, so, talking about the lapse or the times that we're going to do on Tuesdays, and now I didn't realize Wednesdays, to be honest with you, but do we have a direct link that legislators can write emails to try to expedite people that are trying to call in those days? I have a funny, Rev Abercrombie said, our offices are going to get inundated. It's happened before with other agencies. Our offices are our staff is going to go crazy. And we need, 5 hours each week. That's 6 weeks. And if it goes on longer than that, this is the heart of the time when people are applying for DSS benefits. And we need to have some clarity and security that we have somebody to reach out to, or it's going to go crazy.
Representative Case, we don't want your office to be inundated. The fact that you didn't know that we've been doing processing on Wednesdays for over a year now, and that has not resulted in inundation of your offices on Wednesdays, gives me some comfort that you won't get inundated as a result of this temporary processing time. And as I've been trying to explain, we really believe that this is going to result in fewer people needing to contact you and needing to contact us, because we'll be getting the work done and getting their benefits out to them. That being said, if you start getting lots of phone calls, you know how to reach me, and we will, take measures to address those concerns. The purpose here is definitely not to make more work. It's to get the work done more quickly. So let us know, Rep Case, if you start getting lots of additional phone calls.
Now, but you say, so 150 employees will give you a comfort level of having enough people to start process. How many are you down in employees?
I believe we're down 230, but I have an email here. Let me get it for you.
But 150 need 2 months to come up to speed.
We have 251 staff vacancies right now.
Is that because of retirements?
It's due to a number of different issues. Some of it is retirements. Some of it is people that have been promoted to either other agencies or other positions within DSS. Just turnover. But, the retirement wave certainly hasn't helped. So the 150 people are being onboarded now. And that, that's going to help us, as I mentioned, with this quick turnaround first touch. And then we're continuing with another wave of hiring to get up to the 250 we need to.
Thank you. Thank you for your answers. Maybe those Wednesday calls are the 2 or 3 I get every day, but we get those settled through our legislative liaison. So thank you, Senator. And thank you, Commissioner.
You're welcome.
Thank you, Representative Johnson for the second time.
Thank you, Madam Chair. And one more question, Commissioner. I have a question about the processing of the claims or applicants. If somebody makes an application for one particular type of claim in, say, in a Medicaid program, and they qualify for, say, instead of a Medicare Husky C or D, they qualify for the Medicare Savings Program, do you automatically process those to the next lower level, or do you make the person reapply?
So it's a really good question, and there's not a single answer. We do have a single streamlined application for several of our programs, but not every single program. On MSP in particular, Peter, do they automatically get enrolled? I'm not sure.
Yeah, we do have a lot of processes around transitioning folks, for instance, who are aging off of Husky D into the MSP program. We work closely with our federal partners to process files about people who are enrolling in Medicare. There's very good processes for getting people into MSP. And if someone indicates that they're applying for medical assistance broadly, they'll be evaluated for all possible coverage types, including MSP.
Because I've run into problems with my constituents also in that circumstance where they have to go through the processing all over again when it seems to me they might be, or it looks to me like anyway, that they would be eligible for MSP as opposed to a Husky program.
All set, Representative Johnson?
Yes, thank you so much, Madam Chair.
Thank you very much. I don't see any other questions, Commissioner.
Senator, you muted yourself accidentally.
I was trying to eat a peanut butter and honey sandwich at the same time as do this. I was starving. And so thank you very much, Commissioner. Appreciate it.
You're welcome. Thank you.
We have no more questions right now. We're going to go into the public speaking part of it. And suffice it to say that both of these women do a lot for everybody. So it would be really helpful if we didn't all have to get on and say thank you very much for what you do. So we'll say a broad thank you very much for everything you do. And Deb Poulin, you are up.
Thank you so much, Senator. For the record, my name is Deb Poulin. I'm the Executive Director of the Connecticut Association for Community Action, or CAFCA, and we are the state association that works with Connecticut's 9 community action agencies, which serve about 200,000 low-income people all across Connecticut, including in every one of your districts. I want to thank all of the committee members who are on today to learn more about these block grants and offer our support for both the social services block grant and the community services block grant allocation plan. The community action agencies, as you know, provide a wide variety of services to low-income people, including energy assistance, enrollment into SNAP, and a variety of different case management services. The community services block grant provides an infrastructure and stability for the community action agencies, more than just funding specific people. The community services block grant helps to ensure that community action agencies have a place to do business, have computers, and are able to put the lights on and hire the background staff and infrastructure to really support the services that are provided to community members. The community services block grant is also used to leverage other funds. And as you'll see in our written testimony, about every dollar of community services block grant funds brings in about $23 of other funding. And so it is a very good investment of federal dollars into our communities. I also want to make sure that you understand that we operate through what we call ROMA, Results-Oriented Management and Accountability. And that's sort of a continuous quality improvement. It kind of makes me think of the RBA that the Appropriations Committee brought up about 10 years ago or so. And this is really important for the community action agencies to monitor what we're doing and the impact that it has on our community members. So we're not just providing services, we're trying to make sure that we're providing the most impactful, effective services that are needed by the people in our communities. And how we determine that is through doing community needs assessments to figure out what are the services that people in our communities need. And we know that those services might vary from Meriden to Griswold to Danbury and all across the state. So we would continue to support the CSBG allocation plan. As far as the social services block grant, we have been providing long-term case management services under SSBG for about 7 years. This program is another really cost-effective way of helping people determine what their goals are, determine what the barriers are to reaching those goals, and then figure out strategies to overcome those barriers with a little bit of hand-holding and case management by the community action agency staff. We have some data included in our testimony, which I would encourage you to read, showing the effectiveness and the impact of the social services block grant case management program. We've also included a map for all of you so that you can find your local community action agency, and would encourage you to direct your constituents to your local CAA if they call you in need of services or programs or support. And I thank you very much for your time today. And I also want to just give a shout out to Commissioner Gifford and the staff at DSS for their partnership in both of these programs.
Thank you, Deb. Representative Abercrombie?
Just real quickly, I want to take the opportunity to say thank you to you, Deb, and to the CAAs. For those of you that work with your CAAs, community action agencies in Meriden, minus New Opportunities, we could not serve our constituents without them. They are a lifeline that goes above and beyond, and there's no better telling than what went on with COVID. So I just want to take this opportunity to say thank you to you guys and to really let you know how much we appreciate the work that you do. Thank you, Madam Chair.
Thank you very much, Representative Abercrombie. Deb, I see no other questions. You're all set. Thank you very much. And again, thanks
Thank
for
you.
you. Up next is Susan Lagarde. Susan?
Madam Chair, Dr. Lagarde has not joined us.
Okay. All righty then. I will close the public hearing portion of this event. We are now going to go on to the voting component of it, and it's going to go in the following order. We're going to start with public health, and then we're going to go to human services, and then we're going to go to approps. So we're going to start with public health, and public health will be doing 4 different block grants. Human services will be doing 3, and then approps does all of them. It's all 7. So I am turning this over, and everybody, the chairs got the process. So in public health, Senator Anwar or Representative Steinberg, who is leading the meeting?
I'm glad to take the lead on that, Madam Chair.
Say it again, sir.
I am glad to take the lead, Madam Chair.
Did you get the email that had the meeting process outlined in it?
I do have that.
Okay. Sir, the floor is yours.
You're too kind, Madam Chair. Allow me to just access the procedure. As chair, I can order that the Public Health Committee convene a meeting to vote on 4 separate grant proposals. And I will ask for a motion and a second to approve the technical changes related to the grant application. Do I have a motion?
So moved.
So moved. I'm not quite sure I followed who moved and seconded, as long as Susan, do you have what you need?
No, sir. So if you could please clarify that the motion is to approve and then list off those 4 block grant allocation plans, including the technical correction to community mental health services.
So let's try again. Thank you for that. I seek a motion to approve with the technical changes the 4 grant allocation plans that are before us today, which include the Maternal and Child Health Services Block Grant Allocation, the Preventative Health and Health Services Block Grant Allocation, the Substance Abuse Prevention and Treatment Block Grant Allocation, and the Community Mental Health Services Block Grant Allocation, which has the technical correction.
Move, Senator Anwar.
Senator Anwar moves. Do I have a second?
Second, Rep. Pettit.
Seconded by Representative Pettit. Are we good now, Sue? Okay. Now open up the floor for any questions, discussion on any of the 4 allocation plans currently before the committee. Does anybody wish to comment or ask questions? Seeing none, I believe we're ready for a vote. Can we vote for them, all 4 of them simultaneously? Good answer. So we will now have a roll call vote on the 4 allocation plans before the Public Health Committee. Madam Administrator, please proceed.
Senator Dorothy Abrams, Representative Steinberg.
Yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes yes, and it's wonderful to see you, Madam Beverly.
thank you, Representative. Representative Arnone, Representative Burgess Givallo,
Representative Berger Gervalo votes yes.
Representative Betts, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster, Representative Jengo,
Representative Jenga votes yes.
Representative Green, Senator Haskell, Representative Cabras DeGraw,
Cabras DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Tardis Detria,
Representative Claritas Detria votes yes.
Representative Lenahan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker, Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Terciak,
Representative Terciak votes yes. Thank you.
Representative Young,
Representative Young votes yes.
Representative Zupkis, Senator Kushner,
Senator Kushner votes yes. Thank you, Beverly.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Arnone, Representative Betts, Representative Dauphiné, Representative Elliott, Representative Foster, Representative Green, Senator Haskell, Representative Lenahan, Representative Parker, Representative Scanlon, Representative Zupkis.
Thank you, Madam Administrator. I'll provide you a moment in which to tally the votes. And whenever you're ready, if you could announce the tally.
Total voting 19, those voting yea 19, those voting absent and not voting 13.
Thank you, Madam Administrator, for your assistance. The 4 allocation plans passed the Public Health Committee. At this time, I will recess the Public Health Committee. Back to you, Chairman Austin.
Thank you very much. Up next is Human Services, Representative Abercrombie or Senator Moore.
Thank you, Madam Chair. I will convene the Human Services Committee meeting. Before I ask for a motion, please allow me the opportunity to name the 3 block grants that we will be voting on. First is the FFY 23 Community Mental Health Services Block Grant Allocation with the technical correction in concurrence with Public Health. FFY 23 Social Services Block Grant Allocation Plan, FFY 23 Community Service Block Grant Allocation Plan. I will entertain a motion and a second.
So moved.
Second, Representative Jason.
It's been moved by Representative Case, second by Representative Hughes. Any discussion? Seeing none, Cass, please call the roll.
Representative Abercrombie,
Abercrombie, yes.
Senator Moore.
Senator Moore, yes. Senator Moore, yes.
There we go. Thank you. Senator Berthel. Representative Case.
Representative Case votes yes.
Senator Lesser.
Senator Lesser votes yes.
One more time, sorry.
Senator Lesser votes yes.
There we go. Thank you. Representative Leeper.
Representative Leeper votes yes.
Senator Cabrera. Representative Butler. Representative Cook.
Representative Cook votes yes.
Thank you. Representative Dathan.
Representative Dathan votes yes.
Representative Garibay.
Representative Garibay votes yes.
Representative Goupil.
Representative Goupil votes yes.
Representative Hughes.
Representative Hughes votes yes.
Sorry, one more time.
Representative Hughes votes yes.
There we go. Thank you. Representative Santiago.
Santiago votes yes.
Representative Stallworth. Representative Aurora. Representative Buckby.
Representative Buckby votes yes. Oh, there's Harry.
I got you, Representative Buckby. Representative Aurora.
I'm sorry, Representative Aurora votes yes.
Thank you.
Thank you so much.
Representative Mastro Francesco. Representative Scott.
Representative Scott votes yes.
Representative Wood.
Representative Wood votes yes.
Thank you. Are there any other members who are now on who haven't had the opportunity to vote?
I don't think, have you started appropriations or this human services?
Human Services.
This is Human
sir.
Services.
Thank you.
Thank you, Madam Chair.
And when you're ready, Cass, please give us a tally.
All right, we had 15 voting. Those voting yay, 15. Those voting nay, 0. Those abstaining, 0. Those absent and not voting, 5.
The block grants pass the Human Services. I will recess the Human Services and turn it over to Appropriations.
Thank you very much, Representative Abercrombie. I'm going to call the Appropriations Committee meeting to order and ask for a motion and a second to approve following grants. Let me read the grants off for the record. Fiscal year 23 Maternal and Child Health Services Block Grant Allocation Plan. Fiscal year 23 Preventative Health and Health Services Block Grant Allocation Plan. Fiscal year 23 Substance Abuse Prevention and Treatment Block Grant Allocation Plan. Fiscal year 23 Community Mental Health Services Block Grant Allocation Plan with technical corrections in concurrence with Human Services and Public Health. Fiscal year 23 Social Services Block Grant Allocation Plan. Fiscal year 23 Community Services Block Grant Allocation Plan. Is there a motion?
So moved, Representative Dathan.
Moved by Representative Dathan.
Second.
Seconded by Representative Porter. Is there any discussion? Being no discussion, Madam Administrator, if you could call the roll, please.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker.
Representative Walker votes in the affirmative.
Senator Hartley,
Senator Hartley in the affirmative.
Representative Dathan,
Representative Dathan votes yes.
Representative Nolan, Senator Minor, Representative France, Representative Abercrombie,
Representative Abercrombie votes yes.
Senator Doherty Abrams, Senator Anwar, Representative Baker,
Representative Baker votes yes.
Representative Betts, Representative Belinsky, Representative Candelaria, Senator Ciccarella,
Senator Ciccarella votes yes.
Representative Curry,
Representative Curry votes yes.
Representative Delaney,
Representative Delaney in the affirmative.
Representative Dillon,
Representative Dillon votes yes.
one more time for me.
Representative Dillon votes yes.
Thank you. Representative Felipe, Representative Felipe, Representative Ferraro,
Representative Ferraro votes yes.
Senator Flexer,
Senator Flexer votes yes.
Representative Gibson, Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Gonzalez, Representative Haddad,
Representative Haddad votes yes.
Representative Carol Hall,
Representative Carol Hall votes yes.
Representative Joshua Hall, Representative Harrison,
Representative Harrison votes yes.
Representative Hayes, Representative Howard,
Representative Howard votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser,
Senator Lesser votes yes.
Senator Lopes,
Senator Lopes votes yes.
Representative Luxembourg, Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
Senator McCrory votes yes.
Representative Paris,
Representative Harris votes yes.
Representative Pavelok-D'Amato,
Pavelok-D'Amato votes yes.
Representative Porter,
Representative Porter votes in the affirmative.
Representative Reyes, Representative Rosario, Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez,
Oh.
Senator McCrory, could you mute for me, please? Thank you, sir.
Absolutely.
Thank you. Representative Sanchez, Representative Sims, Senator Summers,
Senator Summers votes yes.
Representative Tersiak,
Representative Tersiak votes yes.
Representative Wilson,
Representative Wilson votes yes.
Senator Winfield,
Senator Winfield in the affirmative.
Representative Zawistowski,
Representative Zawistowski votes yes.
Representative Felipe,
Representative Felipe votes yes.
are there any other members of the Appropriations Committee who have not yet voted who would like to do so at this time?
Representative Kent,
Could you raise your hands for me, please? Yes, Representative Hall.
Representative Hall votes yes.
Thank you, sir. Representative Candelaria.
Candelaria votes yes.
Thank you. Anyone else?
Yeah, Senator Anwar votes yes.
Thank you, sir. Anyone else?
Madam Administrator, when you have the tally, please announce it.
Total number voting 37, those voting yea 37, those voting nay 0, those abstaining 0, those absent not voting 14.
Thank you very much, Madam Administrator. The motion passes. And before we adjourn and we all go away, Madam Administrator, what else do we have? Do we have anything else coming up in the next week or so?
Oh, blessedly no, Madam Chair.
I am so happy to hear you say that. You have no idea. I'll entertain a motion for the Appropriations Committee to adjourn.
So move.
Moved by Senator Anwar, seconded by Representative McCarty. All those in favor indicate by saying aye.
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 Anybody opposed? The ayes have it. Thank you very much. Appropriations is adjourned. I think we go to Representative Steinberg.
Entertain a motion to adjourn the Public Health Committee meeting. Is there a motion?
So move.
Senator Onward, do I have a second?
Second.
Seconded by Representative Pettit. We're very consistent. All those in favor indicate by saying aye.
Aye.
Any opposed? Good. Thank you. We are adjourned. Thank you, Madam Administrator.
Representative
On to-
Abercrombie.
I will entertain a motion to adjourn the Human Services
So
Committee
moved.
meeting. It's
So
been moved
moved.
by Case. Can I have a second?
Seconded, Hughes.
Seconded by Representative Hughes. Anybody objection? Seeing none, Human Services is adjourned. Thank you, everyone.
Everybody have a nice weekend.
It's only Wednesday.
Thank you, Senator.
God.
Now we're starting today.
We can dream. We can dream, Representative Abercrombie. We can
We're all gonna
dream.
chip in and buy broadband for Rep. Dillon.
Exactly. Exactly.
Or go to Hartford. Could do that. I get the
Thank you,
Lessings menu
everyone.
every day. I get hungry every
Bye.
Thank you, Representative Case. Have a good afternoon.